Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, Oral Human Papillomavirus Infection in HPV-Positive Oropharyngeal Cancer Cases and Their Partners, by Gypsy Amber D'Souza et al. My name is Gypsy Amber D'Souza, and I'm an associate professor at the Johns Hopkins Bloomberg School of Public Health in Baltimore in the United States. My oncologic specialty is in the epidemiology of infection-related cancers. Human papillomavirus, or HPV, causes the majority of oropharyngeal cancers in the United States. Many spouses of patients diagnosed with HPV-positive oropharyngeal cancer have questions about oral HPV transmission and anxiety over their own risk for HPV-related cancers. Our study demonstrated that partners were no more likely to test positive for oral HPV infection than people in the general population, suggesting that partners' risk of HPV-related oropharyngeal cancer remains low. The Hotspot study is the first large study to examine oral HPV infection among patients with HPV-positive oropharyngeal cancer and their partners. This study confirms that couples who have been together for several years do not need to change their intimacy or sexual behavior because of the cancer diagnosis. The study included 164 individuals with HPV-positive oropharyngeal cancer and 93 spouses or long-term partners. Participants rinsed and gargled a sample of mouthwash that was tested for 36 different types of HPV, including HPV-16, the type responsible for most oropharyngeal cancers, as well as causing anal and genital cancers. HPV-16 DNA was detected in 54% of patients with HPV-positive oropharyngeal cancer at diagnosis, but in none of their partners. Indeed, the prevalence of any type of oncogenic or cancer-causing oral HPV was only 1.2% among female partners. That's equal to the prevalence in the general female population of the same age. And among the 6 male partners enrolled in the study, none had an oncogenic oral HPV infection detected. These results suggest that partners of people with HPV-positive oropharyngeal cancer do not have elevated oral HPV infection compared to the general population. We know that HPV is a sexually transmitted virus, and research suggests most oral HPV infections are acquired when performing oral sex. While many of the cancer cases in this study had oral HPV DNA detected in their oral exfoliated cells, much of this HPV DNA may represent small DNA strands sloughed off from the tumor without the viral capsid and thus not infectious. HPV is not casually transmitted, but we do not know if it can be spread by deep kissing, where saliva is shared. The low oral HPV prevalence among partners suggests that either the virus is not usually transmitted by kissing, or that most partners effectively clear any active infections to which they are exposed. While partners did not have HPV-16 DNA detected in their mouths, 10% of female partners had a history of cervical dysplasia or invasive cervical cancer. This is consistent with transmission of HPV to the mouth when performing oral sex on a partner who has an oncogenic genital HPV infection. Therefore, cervical HPV testing for female partners of patients with HPV-positive oropharyngeal cancer is appropriate at the time of diagnosis of HPV-positive oropharyngeal cancer. Among the 17 female cases of HPV-positive oropharyngeal cancer in the study, 2, or 12%, also had a history of cervical dysplasia or cancer. Recent research has shown that women with cervical cancer have an increased risk of HPV-related oropharyngeal cancer. Doctors should tell their patients that these findings suggest the prevalence of oral HPV infection is not increased among partners and the partner's risk of HPV-positive oropharyngeal cancer remains low. Couples who have been together for several years have likely already shared whatever infections they have, and no changes in their physical intimacy are needed. HPV infection is common among men and women in the U.S., but the overwhelming majority of individuals with HPV infection clear these infections and will not get cancer. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.